Greetings, everyone who has joined us. Greetings to all of you. This is a seminar that's coming to you from Bangkok and Brighton. I'm expecting people are joining us from all over the world. So good morning, good afternoon, good evening to all of you. The seminar will begin in about 1 minute. We'll give a little bit of extra time, tiny bit, and then we'll get going. Wait, now I think I'm going to start now. So it's my great pleasure to welcome you all to this seminar. The title of the seminar is Right to Nutrition in its social, legal and political context. And what we're looking at here is how international rights translate into realities in Zambia. And this event, this seminar, is being brought to you by 3 different academic institutions. Why? Because the research that it's drawing on was inherently multidisciplinary, and it was crossing between development studies, food equity and law. And so today's program is a joint seminar, which is between the Food Equity Centre, which is based at the Institute of Development Studies, the Sussex Rights and Justice Research Centre, which is at the University of Sussex, and the Sussex Centre for Human Rights Research at the Sussex Law School. So there's more information available about all these institutions at the links on the slides, and the slides will be made available on the Food Equity Centre event site in due course. And just to point out to you, for the purposes of the seminar, that we will be recording, so if there are any objections, please send a message in the chat. If not, we're going to continue with recording. And just one other thing to say is please take responsibility for muting your own microphones. The host can mute you if there's sort of strange noises coming, but it would be great if you could do that yourselves. The seminar itself will, the speakers will speak for about 30 to 40 minutes, but it's a very interesting story, so I'm sure you'll enjoy it very much. And then we'll have questions and answers, and we'd like you to put your questions in the chat, please. It is possible, of course, to do the questions by voice if you prefer, but put them in the chat as well if you can. And then it's possible for us to go on a bit longer after the hour, so we can go through to an hour and a half for the whole session if it's full of discussion and so on. We're very happy to do that. So just a quick introduction now to the speakers. My name is Patti Scott-Villiers. I'm a member of the Food Equity Centre, and I'd like to introduce to you Jodie Harris, who's a research fellow at the Institute of Development Studies. Her research interest is in the politics and ethics of food systems and nutrition policy, and she conducts research into power in societies, power in policy, and power in international nutrition and food systems, as well as looking at the ethics of intervention into these spaces. And our second speaker, and they're working together, Jodie and Ruth, is Ruth Sturton. She's a senior lecturer at the University of Sussex Law School, approaching legal research in the light of social and political context, and exploring the gap between law and policy as written and the way in which it's implemented on the ground. And she's also looking at the limits of the law. So with that, I will hand you over to Jodie and Ruth.
Thank you, Patti. I hope you can all hear me okay. So in this work then, we're looking at a right to nutrition through social and legal and political lenses. And this project was funded in part by the Global Food Ethics and Policy Programme at Johns Hopkins University. So that focuses on the ethics of food and nutrition policy. And it was funded in part by the Sussex Sustainability Research Programme in the UK, which focuses on research for the Global Sustainable Development Goals, the SDGs. So that means that the project has an ethics focus, but it also aims to say something about sustainable development. So Ruth and I are presenting today on behalf of this fabulous research team in the UK and Zambia. Between us, we're based at the University of Sussex, the Institute of Development Studies at the University of Sussex, the University of Zambia Law School, and the Southern African Institute for Policy and Research based in Lusaka. So I think some of our colleagues are on the line today. So when we get to Q&A, I hope they can also chip in. So let me first give you a bit of background on why we did this work and also what we did. So as background on Zambia then, I've been working for the past decade or more in Zambia in East Africa, and the nutrition situation there is pretty dire by the numbers. So the major issues are child stunting or being clinically too short for their age at 35% of children under 5, that's high. Also child wasting, being too thin for their height at 5% of children, but that's more seriously associated with severe illness and death. Also hunger, not having enough calories for an active life at 45% of the population, that's adults and children, and particularly seasonal hunger. But then overweight is rising, particularly among women, and diets at either end of that spectrum, that scale, are monotonous and generally lack diversity and good nutrition. So lots of people are working to address those issues in lots of different ways. And one of those ways is through working on human rights. So several global nutrition organizations and Zambian national policies reference human rights as among guiding principles for addressing malnutrition. But in years of work in this field, I hadn't seen much evidence of human rights actually guiding action at many levels. And people I spoke to either weren't clear on what that should be, what that means, or had conflicting views on what that means when they were very clear what they thought it meant. So to be clear on our positionality in undertaking this research, all of us authors, we are educated lawyers or development academics who broadly share the aspirations that are embodied in human rights. But we also don't accept those ideas uncritically. So we want to know what use they are in addressing pressing issues like malnutrition. So we wanted to understand through our research how these sort of exclamations on this slide touch on the malnutrition realities on the previous slide. So a bit of academic background. So I won't go into the enormous literature on what human rights are or what they should be. But debates go back a very long way. So this, I had to put it in there, it's a picture of a pub next to the law courts in my hometown of Lewes in the UK. And it's named for Thomas Paine, who before he headed off to America and got involved in the independence movement, he sat in my town and wrote his famous book, Rights of Man, in 1791. So these debates on rights go back a very long time. And authors reviewing those long debates on rights and bringing them into the field of nutrition have generally drawn on two broad sort of ideas or frameworks that have emerged over time. So one is the respect, protect, fulfill framework, whereby states are required to progressively respect or protect or in extremis fulfill rights to which they've signed up. And the other is this idea of rights holders as citizens and duty bearers as governments who are joined together through a written or unwritten social contract. So those two ideas are broadly drawn on in the conceptual right to nutrition literature as well. And then after understanding what rights might be, we also need to understand what a right to nutrition might be a right to. So nutrition has a bit of a curious place in international development. For decades, it was placed under the health sector as a sort of curative action. And then it was realized that food is quite important to nutrition. So the most widely used framework sees nutrition outcomes as a sort of combination of food and health, and for children also childcare. So it's known as the Food, Health and Care Framework. So human rights theory sees rights as indivisible. So practically achieving a right to nutrition might require action on all of those areas. And then crucially, who are we talking about a right to nutrition for? So in international development practice, we often talk about the nutrition of women and children, or just children, but rights as originally envisaged are universal, they're for everyone. So how do rights relate to those and other population groups in practice? And then beyond whether nutrition is conceptualized as an issue of food or health or both or neither, is what kind of a tool human rights might be in actually achieving better nutrition or reductions in malnutrition, however you frame it. So we felt that different literature that we reviewed implicitly conceptualizes the right to nutrition either as rhetorical, as a sort of moral call to action, or as legal, based in international covenants and national law, or a sort of practice-based framework, rights-based approaches, elaborating tools for achieving different bits of rights. So we used that sort of tripartite idea in analysing our own research findings, and we'll talk a bit more about that later. So each of these issues on the slide has been written about conceptually, but there was very little empirical work asking how these played out in practice and how the different groups involved in human rights and nutrition work understood the role of rights in achieving good nutrition. So each of those sets of ideas, what rights are, what a right to nutrition is, who the right's for, and how rights might be utilised, played a role in formulating and analysing the empirical data for this project. So we felt there was a need to better understand how human rights have shaped or might shape nutrition action, so that we can make better decisions about how and where to invest the energy of the nutrition community going forward. So we might also have something to say about sort of practical human rights work in general from this nutrition case study as well. So our work explored empirically how a right to nutrition is perceived by different actors at global level and at African regional level and at multiple levels within Zambia, and then how differences in interpretation of this thing, a right to nutrition, might affect its potential for reducing malnutrition. So as a development studies researcher and a legal researcher, Ruth and I felt we had the sort of beginnings of a pretty good team to look at that from some complementary angles. So we brought socio-legal approaches, critical development studies approaches, and political science sort of lenses to this work. So to try and address our question, this is our conceptual framework for the study, and it followed concepts from the sort of international realm of UN conventions and regional policy, international legal and policy framing, and then onwards to the interpretation of those ideas in development practice, and then how they're received by citizens. So the research had ethical clearance both in the UK and in Zambia. And this table shows research methods and data mapped to our sort of conceptual framework, those different levels and different areas of practice. So the research began with a literature review in multiple disciplines, and I mentioned some of the broad brush findings from that before. And then we undertook an intensive document analysis of policies and legislation to understand what's written in national and international policies and strategies and regulations. And that included a legal analysis of legislation and case law in Zambia. And then we continued with key informant interviews to understand how those documents were created and how the concepts and ideas that they contain are used and understood in practice. So we interviewed 23 experts from government and legal and civil society sectors at the international and national levels. And then we spoke with 92 citizens from 13 different focus groups in rural and urban Zambia. And so in our analysis of all of this data, we looked for similarities and differences across the levels and between different actor groups. And then we looked to explain our empirical findings through the theories and ideas that we saw in the literature. So the research overall, we tried to trace narratives and discourse and ideas through those different levels, looking for continuity or change, both over time and space. And we aim to understand where any sort of disconnects or dilutions happened in people's understanding of what rights might bring to nutrition. So I'm going to hand over to Ruth now for a moment to talk about the findings. So Ruth, go ahead.
Great, thanks, Jodie. If we can have the next slide. So at the international level, there is a whole raft of covenants, conventions and strategies that affirm the right to nutrition specifically and to its various determinants. These relate either to everyone, such as in the 1948 Universal Declaration of Human Rights and the 1966 Covenants on Civil and Political Rights and Economic and Social and Cultural Rights, or they relate to specific populations, such as the 1979 Convention on the Elimination of All Forms of Discrimination Against Women, or the 1990 African Charter on the Rights and Welfare of the Child. They relate to broad overarching rights, such as the right to life, seen in the Universal Declaration and the Covenant on Civil and Political Rights, as well as more specific rights, such as a right to food in the Covenant on Economic, Cultural and Social Rights. And there are specific definitions and recommendations on what a right to food entails in the General Comment number 12 from 1999. Human rights are then invoked in domestic policy and law in Zambia. So the National Guiding Vision 2030 is based on respect for human rights as one of the 7 basic principles as a basis for the vision. And rights are invoked in the country's 2008 National Food and Nutrition Policy, in which it states that the government reaffirms that equity of access to food and nutrition is a basic human right. In the 2011 National Food and Nutrition Strategic Plan, which operationalises this policy, the document only notes that the use of the rights-based approach has also been identified as a catalyst to achieving nutrition targets. And the 2013 Most Critical Days programme, which focused on child malnutrition, does not mention human rights at all. So human rights are clearly integrated with ideas of nutrition and of nutrition's core determinants, food and health, as Jodie mentioned earlier, in the written covenants, the conventions and policy across international, regional and national levels. And rights covenants are becoming more explicit on issues of nutrition, both globally and regionally. And rights are mentioned in high-level strategy documentation in Zambia. But this rights language is used without clear meaning in some instances across levels of documents. And the language becomes weaker and less defined and eventually disappears. And the population groups covered by the language gets narrower. So people, women and children, children or women, as the documents get closer to being actionable within the Zambian national context. So we've got a funneling, if you like, of broad rights to much more narrow rights the closer it gets to people being able to do things. So if we go to our tripartite framework then, if we start with rights as rhetorical, and there's a couple of quotes on the slide, the respondents to interviews for this research at international and regional levels, suggested that rights language was being deployed as a rhetorical device rather than being a clear basis for action. And some policy actors at the international level described rights as occurring in preambles to documents, but being lost in practice, while some civil society actors described rights variously as window dressing and keeping up with the Joneses and a public relations measure. And we found that the language of rights was largely rhetorical in the written policy and the international covenants. It was there to provide moral leverage or a range of conceptual ideas and a call to action, but it wasn't directing action in clear or consistent ways that could be used by people working in this field. So the second of our tripartite framework is rights as legal. And the question that arises is the extent to which the rights language grants valuable legal rights to the citizens of Zambia. And one way that these documents have been used more concretely is that Zambia has domesticated international human rights law to an extent. So the legal framework in Zambia requires international human rights to be formally brought into Zambian domestic law, hence domesticated, before they can be justiciable in a Zambian court. So, for example, the Affiliation and Maintenance of Children Act 1995 specifically domesticates the UN Convention on the Rights of the Child into Zambian law, but it makes no reference to the original provisions relating to food, nutrition, health, or care. So those rights, which are present in the UN Convention, are not justiciable in the Zambian courts. They have not been explicitly domesticated into Zambian law. And then there's an additional level of challenge for the Zambian people, if that's the best way to put it, is that Zambia has a dualist legal system which encompasses customary law as well as the formal common law legal system. And so the courts where these sorts of human rights cases might be heard are not actually easily accessible to much of the population. So given the challenges for the ordinary individual to access in-country legal services,
we could take the case to the university visitor and have them rule on it.
The option for complaining to the relevant UN treaty body to enforce their rights at the international level is so distant as to barely count as an option. So in practice then, these international rights are unenforceable by the individual rights holder. So this domestication requirement is a significant barrier to the legal enforceability of international rights by individual rights holders. So what we see in this is that at the international and regional levels, the rights are constructed in such a way that they are full of content, they're full of substance, they're broad, they're applicable to everybody, but there's no real enforcement mechanism available to the ordinary individual at that level. So to look at enforceability, we need to go to the national law. Now, a really strong legal right to nutrition would have clear content and scope and a strong enforceability mechanism for the individual to hold the state to account. And when we started the research, it was looking like this just wasn't available. But in 2019, right in the middle of the project, a critical juncture occurred and this case came to the Supreme Court. So this is the case of George Peter Mwanza and Melvin Bean and the Attorney General in 2019. And this relates to food provision for adult prisoners. Now, in that case, the appellants, Mwanza and Bean, were HIV positive and were in custody at Lusaka Central Prison. And their claim was that the food provided by the prison was inadequate in quantity and it was deficient in nutritional content. And as such, it was not taking into account their health condition. And you know, in parts, they went further and said it was harming their health. And their argument was that this was a breach of their right to life and their right to be protected from inhuman and degrading treatment, both of which are justiciable under the Zambian constitution. Now, the Supreme Court of Zambia agreed and found in favour of these appellants and held that these rights had been breached. Now, the lawyers amongst us will all grasp that this case itself is very limited in that these men who have HIV and are in prison were entitled to be provided with more nutritional food for those reasons. But the potential ramifications of this case are hugely significant. The Supreme Court of Zambia held that the right to life encompasses a right to nutrition. And that potential is there for development, for broadening in the next case and the case after that. So what we see from this very timely and convenient use of national law, I say convenient for our purposes, perhaps not for others, this use of the law strengthens policy. It makes a right to nutrition a justiciable right, one that is enforceable by an ordinary member of the population in a national court of law. But we also see that it brings a narrowing of focus. The broad sweeping rights, the indivisible rights that we see in the international level documents are at the domestic legal level guaranteed to a very small population of prisoners who are HIV positive, sorry. So while there is scope for this breadth of the right to return, it's dependent on the development of Zambian common law. So it needs the next case to expand this area. And so our data on this legal right demonstrates quite strongly that there is a balance between the scope of a right to nutrition and its enforceability. And in exactly the same way as in the policy documents, when we move through the levels that were in the table, so as we move from global to regional to national to local, the balance changes such that as enforceability increases, content decreases. I like to use my hands to move things. So a right to what then? Well, in our interviews with the respondents at the international level, there was disagreement about what constitutes a right to nutrition and whether it should be a separate right. On whether nutrition should be a separate right, there were differences rooted in both interpretation and practicality. Some felt that nutrition already is a right that can and should be interpreted from other written rights, such as food and health. and that proliferation of ever more rights would not be positive for the view of rights in general. Others felt that since nutrition underpins multiple other rights, it should be recognised separately as a right in its own right, if you will. At the national level in Zambia, respondents made similar links to interconnected sets of rights, but went much further in describing the practical aspects of what claiming a right to nutrition might mean in context, particularly in terms of related policy and programmatic areas. The citizen focus groups revealed even more practical orientations to the idea of a right to nutrition at a community level. In and of itself, rights was a difficult concept to grasp in several of these focus groups, not least because the Zambian languages don't have a direct translation of the word rights. So it came to be understood as the ability to freely choose what one eats or buys or cultivates without interference, but also often without reference to an obligation of support from the state. Respondents did see a practical role for the state and civil society in helping people overcome their barriers to this freedom, but were less vocal about any obligation on the state as any kind of duty bearer. So views on what a right to nutrition means in practice change across levels, from international technical experts to national citizens. International actors tend to speak and write about nutrition rights, drawing on technical frameworks based on conceptual determinants of nutrition, food, health, and care, and the frameworks of duty bearers and rights holders. Whereas the citizens jump directly to food as the primary driver and health as the outcome. And respondents at each level are not homogenous, although there were similarities in the responses amongst the respondent groups: policy, legal, civil society, and citizens. So what we came to with this is that the right to nutrition lacks a norm. There is no morally grounded, collectively shared, sufficiently specific, socially obligatory idea with clear duties and consequences for defined actors. So for malnutrition, while the moral frame for action clearly exists and it has shaped the rhetoric, the lack of a norm means there's no consensus on who should be acting, what they should be doing, and what the consequences should be if they don't act or don't do anything. Which brings us neatly to the third part of our tripartite framework, rights as a practical concept. There is a lack of consensus over the process of ensuring rights, from lobbying government for policy change to bringing legal cases to educating communities about their entitlements. From a practical standpoint, it has been argued in the literature that areas needed in practical work to achieve rights are citizen participation and accountability of those in authority. Some have argued that practices towards a right to nutrition should come from the affected communities themselves, an approach which echoes participatory approaches to development. Our work suggests that to find consensus on norms around a right to nutrition, one would have to work with very specific groups, likely small, homogeneous groups and localized groups, because the definitions of both nutrition and rights are varied between people at all levels. Some rights proponents have suggested that rights education is key here, and that rights systems only work when the rights holders know what their rights are. So a careful balance would have to be struck between allowing principles to emerge from communities while also introducing education from a normative rights perspective. It has also been claimed that accountability is the key mechanism that makes rights an effective approach and is the major added value of a rights-based approach. It's also been shown, however, that the lack of a norm for economic and social rights underpinning issues such as freedom from hunger means that in many cases there is no clear actor to be held to account, or rather that there may be multiple responsible actors at different times and in different contexts, but there are no clear consequences for inaction, which is backed up by social consensus. Now, our work demonstrates that there's no clear norm and no clear accountability target identified by respondents, meaning that accountability for nutrition is also very diffuse. Some work has examined the effectiveness of initiatives that seek to increase citizens' voices and public sector responsiveness in the delivery of services, but more work is needed on this in the context of nutrition. So I'm going to hand back to Jodie for the conclusions and next steps.
Thanks, Ruth. So what does all that mean? That was a lot of our work, a lot of our lives put into doing that work. So what do we think it means? So for nutrition in Zambia, this study of a right to nutrition, both sort of globally and in the Zambian context, has highlighted the rhetorical nature of a lot of those calls for rights that are there in many of the policies and covenants and organizational mandates. It's also shown how the language has shaped in some more concrete ways the engagement of Zambian law with the right to nutrition, albeit, as Ruth said, one of more limited scope in order to achieve justiciability. And the possibility that sort of formative moments like that Mwanza case can be grasped by activists to shape the law in ways that are even more supportive of the right. It's also highlighted the lack of action on a right to nutrition in practice in Zambia, particularly in the areas of participation and accountability that might enable ordinary Zambian citizens to access those rights through legal mechanisms or through engagement with the authorities. So in Zambia, we think the rhetoric of a right to nutrition is relatively clear, and the Mwanza case provides a legal basis for a limited right to nutrition. But more needs to be done on that legal side, and of course practical implementation in terms of rights education or participation or accountability is clearly lacking. And then beyond Zambia, we feel like a major point that our research demonstrates is that there are these three distinct aspects to the ways that human rights are understood and used. And this sort of tripartite structure hasn't been made clear in previous work on nutrition or even in rights more broadly as far as we can see. So rights as rhetorical, playing that normative function in setting the tone and providing legitimacy and a strong moral basis for advocacy. Rights as legal, as a sort of potential enforcement mechanism, albeit one that tends towards a narrower focus as enforcement gets stronger, and one that's not accessible to many as it stands. And rights as practical, acknowledging that context is critical to action on rights and calling for a strengthening of participation and accountability in different contexts. So we argue that explicitly acknowledging the existence of these rhetorical, legal and practical functions of human rights is a really important first step in sort of moving forwards in this right to nutrition that has sort of languished for quite a long time. So whatever sector or discipline or perspective you come from originally, acknowledging that these different sort of functions of rights exist. And then addressing those three aspects of a right to nutrition altogether, instead of by very separate constituencies as happens now, is fundamental to a more coherent rights-based approach to nutrition. So these three aspects of human rights, the rhetoric and the law and the practice, will play out differently in different contexts. But this empirical analysis, our case study, has shown them to be sort of critical faces of human rights that work together and should be considered together in understanding a right to nutrition, and also probably the achievement of rights more generally. So that's what we found. So in terms of next steps, as well as publishing the paper, which is under review at the Journal of Human Rights Practice, we're going to be writing a blog of those high-level findings on the three aspects of rights to feed into the UN Food Systems Summit this year. Lots of you probably know it's been controversial for not considering human rights in its framing, so we'll feed that in. And then we're also working on a policy and practice brief for the Zambian context for policymakers and activists there to give a bit more detail on what's going on in Zambia and what can be done. So we're very keen to hear your thoughts on this work, to engage with others doing similar work as well. We would like to thank those who have helped us to shape this work over the course of the past few years, particularly Helen Dancer, Dolph Talantello and Cara Flowers, and in particular all those who gave their time to be part of this work. I think some people are on the call today, and it's very much appreciated. So do feel free to get in touch with either of us with thoughts or ideas, but now we're going to be very happy to answer any questions that you might have. So back to Pata. Thank you.
Thank you very much indeed. And Ruth, that's fantastic. Is it possible to share the research report with participants of this forum? Jodie will answer that, and you've got it, she's nodding. So in the chat, we've got one, it could be called a question, could be an idea, which I think would be definitely worth putting forward. And I'd like to invite you, while we're getting a response to the first one, for other people to put their questions into the chat, or comments or examples from other places. Please feel free. But Pat McMahon is noting that the New Sun movement strategy, of which Zambia is a member, only mentions the right to food twice. But what's interesting here is that Pat's suggesting this idea of a test case, which could be taken in terms of the right to life, in terms of child and maternal mortality due to insufficient food. You know, would this be an example of a case that could sort of up the ante from the case of the sufferers of HIV/AIDS in prison? Because, for example, low coverage rates of essential nutrition actions in the first 1,000 days leads to an infringement of the right to life. So that's a question that we might pose to Ruth, to see whether or not you think that that would be one of the ways forward from this really interesting research. So can I go ahead and ask Ruth to answer while we look for other people?
Go for it. Where to go after the Mwanza case is a question that we have kicked around a lot, and I think the way to work it out is to identify the characteristics of the Mwanza case that led to it being successful. And in that case, there was a very, very clear link and causal link between the poor nutrition in the prison and the health outcomes for the prisoners. So that's one important characteristic. The other important characteristic is that because the men were in prison, the prison was solely responsible for providing them with nutrition. So they had no choice. And so I think it's the combination of those two characteristics that meant that that case was found, you know, the decision was made in that way. So development of the law, if either of those characteristics are not present in the next case, then it would depend on having a very activist bench making the decision. And it would also depend on the wider political and social consequences of making that decision. So the wider political and social consequences of the Mwanza decision are that prisons need to provide adequately nutritious food to their inmates. And that's, in the terms of the population of Zambia, is a relatively small and relatively cheap thing to do. Using child and maternal mortality, there's a lot of women and there's a lot of children in Zambia, so it's a big problem. If it's a government responsibility, it's a very, very big and expensive problem for the government to fund, and those sorts of issues would make it less likely for this sort of case to be directly successful. So in order to take this case law forward, what you need is a case where the people receiving the food have no choice about what they receive, and it's a relatively small number of people who are impacted by this. So babies on special care units in hospitals where the hospital has the sole responsibility for feeding that child could be a test case. But broader than that, it might be more likely to fail.
I'd quite like to see whether Pat would like to come back on that. We've got a couple more questions from David and Lydia, but Pat, would you like to come back on that with your point of view? Do you agree with what Ruth is saying? Would you like to come with a background to what you were opposing there?
Yeah. Can you hear me?
Yes.
Thanks for an amazing webinar. Really, that's so thoughtful and so, from our perspective, looking at human rights, so on the ball. So really, you really hit all the points. So thanks very much for super informative, well-presented webinar. I think in terms of Ruth's point, I completely take that on board. However, I would say we're pushing it, putting it onto the government is one thing, but a lot of these, like overseas development aid organizations like UNICEF mandate. So I think bringing it broader I would suggest maybe looking at it from the international perspective, the donor perspective, rather than all on the government. And it could be a way to mobilize external funding for governments by saying, actually, we're not fulfilling the right to life, the right to food, because economically we can't. Countries like Zambia cannot fulfill this right, and that's why international aid organizations and donor funding happens, but it's insufficient. So I think it could be something to turn on the head of government and say, now you help us fulfill the right to food, is what I would say.
Fantastic. Thanks, Pat. That's a really great idea. Okay, so let's move to...
We also just moved to, we have another, sorry, Pat, we have another of our colleagues on the line, Sarah, and she is also a lawyer. And I wondered if she had anything to add, because she lives in Zambia.
Well, I don't live there anymore, actually, but I did live there up until recently. But yeah, just maybe another couple of points on bringing another case and what might happen next. Less so from like the legal principles that were brought out in the case, but from a practical perspective in terms of what is possible or what barriers there might be, because there are limitations, for example, on to what extent legal representatives would be able to take on a case on a no fee basis, and there isn't really the legal environment to allow advocates to do that, and you'd then be asking them to do that for free, and there's a lot of limitations on legal aid and representing people for no fees. So that makes it also quite difficult, and I think as does class actions, which are not really provided for either. So trying to bring a case on behalf of a large number, like Ruth was saying, has that kind of limitation as well. So you'd be looking at quite a lot of barriers, I suppose, to be bringing another case. So it does seem like you'd have to chip away at it, as Ruth was saying, going for something that was fairly similar. Could you find a discrete group? Could you find, appropriate funding mechanism for the case that would be permitted within the rules of the Law Society and things like that? So that, yeah.
Thanks, Sarah. That's brilliant. Okay, I'm going to move on to David and then Lydia. I'm going to put these 2 points together. There's a question about why the right to nutrition. David Patterson thanks the presenters very much for a very interesting presentation. Could you elaborate on why you chose to discuss the right to nutrition rather than the mainstream right to, in brackets, adequate food, which include the concept of nutrition? It was a bit confusing, perhaps. And Lydia adds, did your respondents make a distinction between the right to food and the right to nutrition? Was the nuancing there on this being more than access to calories? Is there more to this? Thank you.
Yes, important points for sure. So the reason that we chose to look at a right to nutrition is because there's been an active and vocal debate on this. Should a right to nutrition be interpreted from the existing covenants on a right to food, or should a right to nutrition be its own right? And there are people who come down on both sides, and we as sort of working internationally on nutrition have been exposed to both sides, and we realize that there are very strong views on both sides. One, that we shouldn't have a proliferation of rights, and that a right to food, as David says, can be interpreted to mean a right to nutrition. And others that said no, otherwise nutrition gets lost among all these rights and in a right to food. So it should be its own right. So this debate exists, and we chose to focus on nutrition because that debate exists, and because we were looking specifically at those nutrition outcomes that I showed on the first slide. And we wanted to get a sense of whether it was felt that there was a difference between these 2 things at those different levels. So we knew that the international debates among sort of UN lawyers and global academics had this split, but we didn't know how it was felt at Zambian national level or among Zambian citizens. There has been some work done by Pata and Dolph and Naomi Hussein on a right to food and how a right to food is seen, including in Zambia, but nobody had looked at a right to nutrition. So we wanted to look at it because we knew that these debates existed, and we wanted to understand how they played out at different levels and not just this sort of global level that I was generally exposed to. So in terms of Lydia's question on whether respondents at the different levels saw a distinction between a right to food and nutrition, certainly there was that distinction at sort of global level in the international debates. But it was also there among citizens. So people very much jumped to a right to food when we started talking about a right to nutrition. So the Zambian languages that we were working in don't have a direct translation for rights. They also don't have a direct translation for the word nutrition. So it was quite hard to lead community debates on a right to nutrition when there is no direct translation for either of those words. So we had to be careful in those focus groups to build ideas without leading people down certain routes. But it was very clear that when we started talking about ideas of food and health, that people saw a right to nutrition generally as a right to food, but as a right to nutritious food, not just a right to maize, which is the staple in Zambia, but very much there was nuancing on this being more than access to calories. But it wasn't as it wasn't using those international frameworks. It was, of course, Zambian citizens weren't using the Food, Health and Care UNICEF framework. They did jump much more to sort of food as the thing that needed to be obtained and health as the outcome that you got from that, rather than food and health being inputs into nutrition. So it was seen differently at the different levels, but the same ideas were talked about certainly across those levels. And I think looking at a right to nutrition rather than the usual right to food was important in getting to some of that nuance, as Lydia says, the nuance of it being more than access to calories, which is sometimes what a right to food can be seen as. So yeah, I hope that answers both of those questions, but I think the debate is very much still open on whether a right to food is different to a right to nutrition, and whether it should be framed as such in different covenants and conventions. But the point of our work is to illustrate that people do see it differently, not to come down on either side, but to say, look, there are these differences, and we need to acknowledge those, both between different groups at the same level and across these conceptual levels, in order to move forward. So I think that's what we hope that we contribute.
Thanks, thanks, Jodie. Ruth, do you want to add, or shall we?
I think Jodie covered that really nicely.
Okay. That's fantastic. In some ways, the next question may be cycling back to the question about the sort of responsible institutions, the ones where people have less choice, but linking interestingly us to the sort of governmental responsibility for this, as well as the institution itself, by asking, do schools, this is from Gil Ton, who says, do schools offer school meals? And if so, is the right to nutrition mentioned in discussions of this policy? So maybe it covers both those issues, food, nutrition, and institutional responsibility. I'm just wondering whether I should ask Nick's question as well, which I haven't read yet. So Nick says, really great study. Congratulations to the team. Agree with Jodie on the approach taken, and in response to David, also worth remembering that when we talk about nutrition from the perspective of public health, it also means is the right circumstances for child growth, healthy bodies, and protection from disease, which of course requires adequate care, broader health systems, and so on and so on. And this is not adequately covered by a right to food in many contexts. So there's a question here about schools and school meals, but also a question again about right to food, right to nutrition in that debate. So who should I put that to? I can see you, Jodie, so why don't you?
Okay, I'll start, but I think probably Ruth is the one to answer about the policy. So yeah, I mean, I think Nick was just sort of building on the point there that nutrition is different to food, but it doesn't have to be. Different people interpret it in different ways, but that at the sort of global level, this food, health and care framework is not covered just by a right to food. So it depends how you see food and how you see nutrition, and that was the point. In terms of schools offering school meals, there is a school meal policy in Zambia, but it's not grounded in rights, it's very practical. So Ruth, I don't know if that would be a slightly more specific case for a legal case to be brought, or whether we're again going back to the sort of more rhetorical and practical aspects of rights. Certainly the plan is that we will we'll develop the policy brief, but then we hope to work with people in Zambia who are working on these issues to try and think through these different issues and what might be a useful, if anyone there who wants to take forward a legal route, what might be a legal route, but then also how to use those sort of rhetorical and practical aspects of rights as well. So Ruth or Sarah, I don't know if you have any thoughts on whether school meals might offer a different route legally.
I mean, the advantage of school meals is that they involve children, and courts tend to be more sympathetic to the rights of children. I guess the less the thing that's slightly different about schools from prisons is that children get to arrive in the morning and go home at the end of the day, and so they don't have all of their food provided by the school, and so that would be a point of divergence that a court would have to consider. So it might be it would be important to consider the extent to which the provision of food by a school was the main provision of food to a child, and what food was available to them outside of the school period, as to whether that might be a successful, another route to take this in the legal development. Now, if you're talking about a boarding school, then that is closer, if you like, in the sense that a boarding school would provide all the food to its children. But then there's a question about, well, if who is paying for boarding schools, if parents are paying for boarding schools, there would be an expectation that food was adequately, nutritious, and so there might be it might be less likely that there's the actual practical problem of non-nutritious food being provided at a boarding school. So that would be the issue that might be a challenge. I think one of the things that is interesting, and this is a kind of another interesting point, is that whilst there is a legal requirement for workplaces to provide either canteens or to provide food vouchers to their employees so that workers have access to one nutritious meal during their working time. And that came about through the development of employment rights. I think it was in the 90s. I can't remember off the top of my head when that act is dated. And it's not couched in terms of rights, but it's very clear that there is an obligation to provide workers with nutritious food in a very specific context. So legislation has been put in place that protects a right to nutrition. It doesn't call it that. Sarah may well have some views on this as well.
No, I agree with all the things you're saying. I think the other thing that came to mind when you were talking about boarding schools is who then might the duty bearers be, because those boarding schools, I think, are often not state-run. They may be religious organisations. So then that would be a different dynamic as well, because in the prison system, obviously, it's the state provision. So you might need to, again, narrow it to a state-run residential environment. What was the other point? I think it's gone. If it comes back, I'll mention it. But yeah, otherwise, I agree with what you said.
Thank you. That's fantastic. Fatima Abdullah, talking from Zambia, I would believe, would like to add to this part of the discussion. She says it's a great study and a very interesting point about healthy canteen meals that have just been made. Fatima works in private practice in Zambia and struggles with this daily as the food provided is deep fried, large in portions, etc. She says it's more a comment than a question, but it's actually a really interesting point about, the degree to which one has a right of access to food or the right of access to nutrition. So moving on, now we're getting a flood of questions. We've got one from Dina, which is about rhetoric. In fact, there's a couple about rhetoric. She wants to know how exceptional rhetorical rights framings are. To what extent is the existence of these nods to rights exceptional to the Zambian context? But also, can you expand further on empirical examples, perhaps from Zambia or beyond, on how the existence of these rhetorical standards does actually allow for legal empowerment? I'm not quite sure what that is, but there we go. Legal empowerment programs or community mobilization efforts. So the link between rhetoric and, some form of mobilization or programming. And then Maria is also talking about the rhetoric question, I think. Appreciating the rights framework you suggested, recognizing the validity of the 3 dimensions in strengthening the implementation of human rights at a local level. And suggesting that maybe the interrelatedness and interconnected nature of rights may provide an additional element to capture the different dimensions that a right to nutrition as a normative concept may encompass, while still retaining a legal foundation, grounding it into existing legal frameworks, like the right to adequate food, or the right to the highest attainable standards of physical and mental health, the right to education, the right to information, and I would add the right to so on, or labour rights and things like that. So there's Maria coming at it from a legal side, and Dina asking about the way rhetoric can inspire programs and mobilisation. Who'd like to comment on those 2 issues? Or shall we just
start, and then I can probably hand over the legal side again. But yeah, in terms of Dina, and then I think also Stephen a bit later on is also asking sort of how exceptional is this to Zambia? And I think probably it's not. I mean, our case study was Zambia, so we wanted to ground this work in a particular place. But I'm sure that these rhetorical rights framings, the use of rights rhetoric without much legal or practice sort of backup going on behind them, I would imagine that that's very common. And I think our framework, or the sort of tripartite thing that we came up with, the rhetorical, legal and practical aspects of rights, can, and I hope now by us or others, will be applied in other contexts, either in research to see what how strong each of those aspects is in terms of framing what happens on rights, or in terms of action, in terms of explicitly addressing both the rhetorical, the legal and the practical aspects of rights. So I don't think that it is exceptional to Zambia, but I think we have a very strong empirical grounding now in this Zambia case study to show that this happened here for this topic in this place. And I think, taking that forward to look at it explicitly in other places, or use it explicitly in other places, will be useful. But Ruth, in terms of using that sort of rhetoric to then ground the law, I don't think we've necessarily gone as far as looking at that, but do you have any other thoughts on that piece, or any piece?
So this is an interesting question, and it is one that is covered in legal literature quite extensively. So there's a lot of discussion of the expressivist function of law, and there is a lot of law that is made into law not because it has any concrete results, but because a declaration of something being lawful or unlawful is in itself important. So what tends to happen is you get these declarations of the importance of something, so the importance of human rights and the importance of protecting human rights, and that makes its way into public dialogue. It makes its way into the public conversation, and then awareness is raised and people start talking about these things as if they are important. And so you get a development in culture around these ideas, such that when they are then brought in a more concrete way in law, there's a less significant transition. So the law has a very powerful rhetorical value, in that it is one tool for changing the way society views ideas. And so having a right to nutrition recognised in the proposed constitution for Zambia was a really significant rhetorical device that would have been have led to a change in cultural views about this idea.
That's very interesting. I think what Jennifer Constantine is saying sort of leads on from that, or comes, it's in alignment with it. She's asking the question of whether you found that activists and policy actors deployed different rights talk or not in different contexts. So depending on what they thought was the most favourable outcome that they could sort of have impact on. She says she's researching how the right to food is or isn't conceptualised and deployed in the UK. And why, and finding that different approaches, ideological, political commitment to a justiciable right to food, or a rhetorical rallying tool, or practical rights-based approaches, or pragmatic pick and mixes, they're all deliberately mobilized differently in different contexts, depending on the politics and the likely outcomes in that particular context. So she'd be interested in hearing your thoughts, and I think it followed on from what you were just saying, Ruth, about the power the legal side has to create a public conversation, but likewise the power of the rhetoric coming in through the political side has on creating the possibility of some given population groups.
Yeah, and I mean, it's a great question, Jennifer. I think we definitely need to talk after this as well, because that sounds like fascinating work as well. I don't think we went as far as looking at whether activists or policy actors purposefully deployed different rights talk. It wasn't our question. It wasn't part of what we were asking, I suppose. So whether people sort of deployed this rights talk and how and where and when, I think we didn't really ask. But I think it's fascinating and fantastic that you also have seen this sort of split between a sort of rhetorical, a legal, and a political rolling out of rights or use of rights in the UK context. So I think something looking at the differences or similarities between those contexts would be super interesting. Yeah, I don't know if that's necessarily answering your question, but I don't think we really looked at exactly the angle that you were looking at, unless, Ruth, you have any other thoughts?
I mean, I was just going to add to that what we saw was people thinking in silos. And so the civil society people who didn't have any interaction with the law tended to have similar sorts of views, and the lawyers had a different set of views, and that there wasn't much linking between the different silos of ideas and the silos of people. So I think we didn't ask these questions, but I think it's hinted at from the data that we collected.
That's great. I think it does also link to a point being made by Vicky, who's in Zambia. She's with UNICEF, who says she'd love to understand how the research can translate into tangible advocacy for the government of Zambia for increased multi-sectoral ownership of nutrition, pitched in the right argument. Want to know if you have insights to who are the key players to move on this, and how do we nuance the findings to ensure increased impact of the SUN efforts. So there's a practical question relating to these issues of rhetoric and law and practice. Good.
No, thank you, Vicky. And I know we've talked about some of these issues, but now you're at UNICEF, I think it's a really important time to talk about this. So we are going to work on this policy brief, and I think it would be nice to do that in collaboration with people who have explicitly expressed an interest in rights-based approaches to nutrition in Zambia. So UNICEF is one, the SUN Civil Society Alliance is certainly another, and others. In terms of multi-sectoral ownership of nutrition, I'm wondering if that's a bit antithetical to a rights-based approach. I haven't thought it through, so I'm just reacting to what you say. But the multi-sectoral approach to nutrition is very much trying to sort of bring all voices together, bringing private sector in along with government, along with civil society. And I wonder if that scatters accountability even more. You know, we found that there wasn't a real sort of norm about who should be doing what, about who should be held accountable. And the sort of the theoretical rights literature says that that should be the state. So yeah, we have to think further about how the sort of multi-sectoral framing fits with a rights-based nutrition, because I know they are two very strong sort of framings that are used in international nutrition. In terms of who the key players are, the theoretical literature would suggest that it's citizens and the state mediated by civil society, but that's very broad. So we can certainly think more about exactly who that would be. But I think for nutrition, the piece that has, you know, the rhetoric is there in terms of the rights. There are a few people doing a little bit of sort of practical stuff on empowerment, but not very much nutrition specifically. But the legal aspect really has been underexplored for Zambia. And we've heard already that it's difficult. It's, you know, it's very specific when you get down to sort of legal cases to be brought. But I think there's more thinking to be done there on sort of public interest litigation and whether there is something that can be built on. So, but I think using those three ideas, you know, the rhetoric, the legal, practical together is what's going to move this forward, but being explicit about that. So some groups in Zambia will be able and much stronger to do the rhetorical, the sort of two arms. Others will be working very much in the practical space and others in the legal space, but thinking and talking and working together, which I suppose you could call a multi-sectoral approach, is probably what's going to move this forward, instead of, as Ruth said, sort of staying in these silos where the lawyers work with the leaders and the civil society NGOs work with the NGOs. So it is a sort of multi-sectoral approach. It's very much trying to use this framework in a more explicit way to look at what needs to be moved, instead of saying we need to do everything we want. Ruth or Sarah, to add on the practicality?
Okay, I just want to say that there's some discussion going on in the chat about specific institutions and also, you know, the question of responsibilities and how easily they are justiciable, and then the question of whether rights should be a special right to nutrition or as part of a greater right. But there's quite an interesting one just come up from Richard Longhouse, which I wanted to throw in now because it's pertinent to this question about who and how inside Zambia itself, which is about history and about how I assume anyway that it has the history of policy, as it were, responsibility for adequate nutrition affects what happens today. Perhaps that's what Richard is thinking about. But so he says that Zambia was one of the first countries many years ago to have a Food and Nutrition Commission. Do you know what they said about food and nutrition when they started up? And I'm sort of reading into why Richard's asking that, but that's for you to discuss.
Yeah, the history is always important of how these things came about. So yeah, the National Food and Nutrition Commission in Zambia was set up in 1967 when lots of African countries were being encouraged to set up these sort of government commissions. And it's one of the few countries where it's still going. It's still a department. It's actually inside the Ministry of Health, which has its own limitations. But yeah, so it does have the National Food and Nutrition Commission still, and we talk to people from there for this research. It doesn't have a rights-based mandate or approach in its original format or when it was sort of renovated a couple of decades later. But as Ruth was saying when she talked about the findings earlier, the National Food and Nutrition Policy, the sort of overarching policy, does have a right to nutrition, specifically food and nutrition, among its sort of guiding principles. But then as it goes to the the strategic plan, and then the actual program that is funded by the government and by donors, that rights language and approach and ideas completely disappear. So the word rights isn't even mentioned in the 2013 program. So it's not, the Commission isn't strongly rights based, but some of the policies that it's written, you know, policies in Zambia and in other places aren't just written by the government, they're written by a sort of consensus group of the UN and donors as well, because capacity is what it is. So where that rights language came from in the policy, we don't know, but certainly it disappeared as it got closer and closer to being funded and enacted. So, you know, there is this scattering of rights rhetoric, both in the Commission and in its policy, but it's obviously not backed strongly enough that it sort of stays there to be a strong backbone of what actually gets done. So it's there, and people in the country who are working on nutrition can build on it. And certainly I think the Commission would be open to it, but it's not sort of part of their core mandate. So yes, I think looking at the history of any of this stuff is really important, both of how the rights sort of came to be, how a right to nutrition came to be or be interpreted, and then also what the institutions in Zambia are doing with rights. And I think all of that history is going to be important for someone like Vicky, who is working kind of at the sharp end of what's happening today. So yeah, thank you, Richard. Nice thought.
And there's also a point from David Patterson about how in South Africa, Section 27 marries legal activism with social mobilization. So he's asking if the Zambian human rights community have been engaged in this debate that you're talking about, because Ruth mentioned silos and whether there were bridges to be built. So that's possibly another practical question about how to make a change in Zambia.
Yeah, and I think, so there isn't a strong human rights to nutrition community. The strongest sort of human rights community, at least on the sort of economic and social rights, has been on the right to antiretroviral treatment for HIV positive people in Zambia over time. And I wonder if that's why the Mwanza case was brought. It was more an HIV activism case, more than it was a nutrition activism case. But that doesn't mean that nutrition actors can't build on it, because it brings together HIV and nutrition, which are obviously intimately related. So yeah, there isn't a super sort of active Zambian human rights community to engage, but certainly it could be built. And I think we totally agree that there are bridges to be built, and that's kind of one of the reasons that we did this work, is or one of the things that we found is, if we can demonstrate that these silos are there, but that others are working on human rights and nutrition in other ways, then it gives a rationale, or it illustrates that bridges need to be built, probably, if we're working towards a right to nutrition, which most of us probably are.
Thank you very much, Jenny. Okay, so then Winston comes in, and you're also sort of following on from various other points made by others about that. You know, you point to Nick's point about the challenge of nutrition positioning itself as a separate right. I wonder whether to frame this whole question about separate or not separate in terms of what the research found was the, I don't know, the thing that had the greatest likelihood of action and change inside the various levels of the Zambia case, rather than us talking about the question in the abstract of whether it should be an individual. I mean, Winston comes to a point of stepping back and questioning all the framings of existing rights, because what Nick pointed out was that care, you know, health, food, and so on, it's a complex thing. So I just wondered what you found from Zambia itself that would suggest to you that there's a kind of way of doing this rights talk that works best in Zambia's situation. Maybe for Vicky, maybe for someone in Vicky's situation, how would it best be framed?
So I think what we tried to do in this research was because we wanted it to be sort of empirical research, was trying not to take a position initially, and to say, what do people at the different levels in the different sectors think when we say the right to nutrition? So our, even our interview guides were very explicit, not to give sort of definitions of what this might be, but to lead people to give us their definitions of what it might be, and how you might go about getting it. So we're very clear, I think, that there are these different framings, and that none of them are necessarily right or wrong. This is a moral position that people take on an issue that people feel differently about, depending on where you sit and who you are and how you're experiencing it. So that was our sort of position in undertaking the work, was to not sort of say we need a right to nutrition, or we don't need a right to nutrition and it should be a right to food, or whatever. We're saying these are the different positions that exist, and you can go and find out about those from different people. If people want to take forward a right to nutrition, they'll have to decide whether that's under its own framework or a food framework. And I think it gets very much to this issue of localization and context. So it depends who you are. Do you work for the UN or an NGO or the government, or are you an academic, or anything else, or a citizen of Zambia? And also the kinds of issues that you already work on. So if you already work strongly on food, then maybe a right to food framing is the one that you take forward. If you already work on health, you take that forward. If you work on nutrition, you can decide if you want to take a right to nutrition forward, and through those different rhetorical, legal, or practical avenues. So I think what our work contributes is a way of clearly thinking through who you are and what you're doing with rights framings, rather than saying everyone should be doing A or B or C. So I hope that's what we sort of do with the framework. And certainly, the next step is to think through with people working in Zambia how that applies to them. But I don't think I could come up with a single answer. I'm sure that's not what Winston's asking for, but that's what we hope we've contributed.
That's brilliant, and I think the framework is wonderful, because it gives you this opportunity to be clear, but at the same time not take these sides. Just a note from Lydia, we're just about to close up now. I think what we should do is perhaps ask Ruth and Jodie and Sarah, if she wants to, if you'd like to say one last thing. And before we close, to note that this is a seminar in the Food Equity series, and the next one will be on July the 20th, and it will be looking at the role of local government in securing the right to food with a perspective from South Africa. And there's a web link there for you to get more details. So with that, I'd like to say thank you very much, but shall we ask just for any final points that Ruth, Jodie or Sarah would like to make to bring this seminar to a close? Any final observations?
I'd just like to say thank you, everybody, for your great questions and for helping us to, well, forcing us to think about where this goes further, because it clearly does go further, and we're keen to do more. So yeah, also keep in touch.
Fantastic. Sarah, anything you'd like to
yeah, maybe just to add on to that, that it was really great to be involved in this research, but also that what people were saying earlier about comparisons to other contexts, I think that would be really interesting, where you could compare the same types of dualistic legal systems that have the same necessity of domestication, but maybe a different activist community, or a more activist legal community. And I think the comparison with South Africa is a really good one, because they do have a really well-established, very litigious type environment. So that would be really interesting. And if you could identify how that grew, under what circumstances, to learn for Zambia's kind of benefit, I think would be really great. So lots of really interesting stuff that could come out of it, I think. So yeah, thanks everyone.
Yeah, lots of interesting stuff. And finally, Jodie, anything you'd like to say?
only to reiterate, I mean, the conversation, the discussion that we've just had after the presentation was far more interesting than anything we had to say. So I'm really looking forward to continuing that, and especially specifically with some of the people who are working on either the issues of rights more broadly or the right to nutrition in Zambia. Yeah, let's carry on. We will reach out. But thank you all for being here, and thank you, Pata, for so ably steering us through those complex questions.
They were brilliant. They were so interesting, as you said, Jodie. They made the seminar absolutely, go with the bang. Thank you, everyone, for joining in. It's been very, very interesting, and we look forward to seeing you again on the 20th of July. Okay, I'll bid you farewell. Or at least it's Jodie to bid us all farewell.